Hello guys, welcome back to RX Taste Pathology. This is Dr. Anjit. So here in this video, I'm primarily going to highlight all the important things what a first year MD pathology resident should know and they should do and the things they should not do. Right? If you're first time here, click on the subscribe button and let's learn more about pathology and medicine in this channel. Right? So here, I'm first of all congrats to everyone who has chosen pathology and who's ready to venture into the sea of pink and blue. It's something a road which is less traveled, but if you are able to excel this road, you'll reach destinations which have not yet been reached, right? So first thing, what I'm not going to kind of scare you initially, but one thing which you have to learn about pathology is the learning curve. The learning curve of pathology is a bit different from the other branches of medicine because what I mean by learning curve is in MBBS you must have read about history taking of medicine, surgery, OG, pediatrics, orthopedics, right? So basic things. So when you go into that divisions of post graduation, it will be a bit easier for you. On the other hand, pathology is something that's very foreign for you. The second year slides, what you must have read, those things only you must have known. You must have mostly looked at the slide outside the microscope and not inside the microscope, right? So from now on in your career, you're going to look at the slide back into the microscope and diagnose it with the same amount of confidence what you diagnose from outside the microscope, right? So the learning curve is a bit steep. It's not difficult. So when a learning curve is very steep, the basics and the foundation should be very, very, very clear and perfect. Because if the basics are clear, it's very simple to build a beautiful building on top. So that basics is what you're going to do in your first year of MD pathology, right? So if I'm sure most of you must have known in your colleges when you're in your internship as well as during your second year, you must have known that pathology has multiple divisions. We have something called in clinical pathology where basic urine examination, all these things are done. We have hematology where the normal routine blood count, the coagulation, the bone marrows, everything is done. We have histopathology where all the biopsies are done, and we have cytology where the pap smears, the FNAs are done, right? So once for a first year of MD, I'll tell you highlight what exactly you have to know in each of these branches. I'll take the main three branch: hematology, histopathology, and cytology, right? So in case of hematology, the simple things, right? So first thing is in how to interpret a CBC. Though it look very, very easy, but it's very complicated and very, very interesting when you get into it. Just by looking at a CBC, you can be an expert if you are able to analyze a CBC perfectly. You can even diagnose a leukemia, a malaria by a CBC. So how to use the machine, sit in the machine, analyze each and everything of that is required, right? Then a normal, simple peripheral smear, right? And a simple normal bone marrow, right? Again, normal things. I'm not going to talk saying that you have to diagnose every leukemia in first year. You will definitely do it, but some things which I want to be done without fail in the first 3-4 months of your second MD pathology is this: learn and interpret a CBC completely. A complete interpretation of CBC is must. Okay, in the first month of posting of hematology, peripheral smear normal. You have to be very confident. Bone marrow normal, how to identify, how to report, how to count the cells, these are completely required, right? And then obviously the techniques. So I say techniques, the staining techniques which must be done by the your hospital, they'll have a manual, read them, get used to them. The machines, you have to know how to start the machine, how to run the machine, PT, APTT, Coulter counter, if you have flow cytometry in your college, flow cytometry, everything regarding the machine, these things are is what I want you to learn in the first 3 or 4 months of your MD pathology in hematology, right? So when you come to cytology, what I want you to do in cytology is pap smear and your thyroid. These are like bread and butter of anyone who is going to practice cytology or pathology in future. This has to be definitely completed in the first posting itself. It's not a big book, 100 odd pages book of pap smear and 100 odd pages of thyroid, and there are very limited, like 6 cases in pap smear, 6 cases in thyroid. If you're able to master them, that's more than enough, right? Very simple things, very, very important, and if you master them the first year, you can go and do multiple wonders in your second year, right? And in FNAC, I want you to master the technique of doing an FNAC, right? How to do an FNAC, how to get a proper material, how to stain a pap smear, how to stain an GMSA smear, all those things, basics and techniques of staining, right? And if your hospital has LBC, that's liquid-based preparation, how to run the machine, you have to know about it, right? Coming to histopathology. So histopathology, in the first year, there are two things which you want to concentrate. First, grossing. I don't want you to know how to give bits, how to give bits as per the case. Simple things of grossing. The entire grossing station, what it is made of, how to describe a specimen, Is it solid? Is it cystic? It's multiloculated, uniloculated, right? Just the basic description. And the best source for reading the basic description of grossing is from your seniors, and go with simple normal books and normal English, whatever you feel, describe them, right? And then must to know is histology. Okay, without knowing histology, please do not expect you to understand pathology. Histology of every organ from head to foot. If I'm going to just throw you a slide randomly without history, you should be able to tell me that it is from the duodenum, not from the intestine. It is from the first part of duodenum. That much accurate you can definitely you'll be able to do it. Head of pancreas, tail of pancreas, you'll be able to identify them, right? So that's how much I want you to be very strong in histology, because once you're done with histology, right, pathology is very simple. It's a deviation of normal, but without knowing normal, you cannot know the abnormal, right? So this is your basic thing which I want you to learn in the first 3 to 4 months. It might sound like it's too much, maybe take 6 months maximum, but this is something which I want you to excel. Only then it's very easy for you to sail in the second half of the first year when you have the second posting of hematist or cytopath, and as well as in the second year. But if this is not done, if it's shaky a little bit, then I believe me, the entire workload will become very, very high and you'll not be able to do anything properly, right? So this must. So next comes is sources. So what do I read? Okay, source is something which is important, right? Because what your brain knows, your eye sees. That's very true in pathology, because pathology is a very theory dependent subject. If I know the lesion, I can identify it. If I don't know the lesion, definitely I cannot identify, right? So first thing, obviously I'll be more than happy if you are a part of RxDX pathology. So we have an app called as an RxDX. You can download that, choose the residency section. In the residency section, you will have pathology. Under that, you have lots and lots of things which will help you to sail through it. I'll definitely come up with more structured videos for first year students, a separate batch for first year students, where you can do all the above mentioned things in a span of 3 4 months by default, right? So if you don't have the app and if you're not subscribed to the app, what are the sources, books which will help you? For Hemat, I'll mention few books that's very good. Take some time and read it. Daisy Lewis has all the basic things of a peripheral smear, the basic things of how a CBC works, how the Coulter works, everything basic is beautifully explained in Daisy Lewis. Don't read about the diseases in Daisy Lewis, though they have it, not required. Only the basics, right? And then we have a book called as Barbara Bain. Barbara Bain is for your hematopathology, is for your bone marrow. Again, in this book, in the first year, I just want you to know how a normal bone marrow looks in an aspirate and in a biopsy. If I want to look at megakaryocytes, I want you to know which area it will be present. Only then when I have a disease of megakaryocytes, I can easily identify them, right? So Barbara Bain and Daisy Lewis are beautiful books which will help you. Don't go to WHO in the first year. We'll see them a little bit later, fine? These are basic things which I want you to know. There are books called Tejinder Singh for hematology, Winthrop's for hematology. Again, in the first 3 4 months, though it will be very tempting, I want you to a little bit withdraw from that. These books, basics are something which is important, right? Cytology, like I said, for pap smear and your thyroid, Bethesda is an ultimate source for cytology. That will be a very, very good book for cytology. You can definitely go and have a look at that. And if it's there with your soft copy or hard copy, learn them. These two books are must to learn in the first 2 3 months, right? And there's a book called as an Oral. Oral is something which I like a lot, and there's a book Indian author called as Pranab De. Both are good enough, but Oral, the basics of how to do FNAC, the techniques, and obviously your seniors help. Hemat cytohistopath, the staining manuals is always based on your college. Don't go with any random books. There are lots of books for doing the stain, but the best thing I'd say, college experience, and from a technician you learn a lot from other than from the books. Fine. When you come to histopath, I told you two things. Grossing is practice, experience, seniors, and your guides, right? We do have a grossing manual in the RSDX app, how to gross and how to describe and everything. If you have access, go and have a look at that. If not, it's from your seniors. That's the best way to learn grossing. And yes, when you come to the second year or the second half of first year, you will definitely, when you learn protocols, I'll tell you the resources where to read the protocols. As of now, grossing, go with the seniors. And histology, there is a book called Histology for Pathologists. Okay, so Histology for Pathologists is a book by Stacy Mills, I think, right? Histology for Pathologists is an amazing book to learn histology. There's one more book called as Vita's Histology. I would prefer Histology for Pathologists because Vita is a hardcore histology book. But this is aligned to what a pathologist will be required. I need not know everything about a microvilli. I need to know what is required for me to identify a disease, right? So Histology for Pathologists is a much better book in my opinion compared to your Vitas histology, right? And for histopathological lesions, biopsy, there are two books, Sternberg, and we have one more called as an Ackerman. I am personally a fan of Sternberg. There are many people who like the way Ackerman describes. Whatever it goes with that. But again, there's not much required in the first initial 2-3 months of your postings of pathology. We'll see that a little bit later, right? So this is what is required for you to ace the first leg or the first semester of pathology. Stay tuned to this channel. I'll make sure your journey of pathology will be made. This is my commitment to the entire pathology community, that we are going to create pathologists in a way that it has never been created. The app has close to 5,000 slides, and we'll be mostly adding a couple of 5,000 more. So that app will have almost every case you want to have a look at. You can just search them with keywords, identify them, have a slide marked with the descriptions. So that will make your life much easier, and it will be able to sail the vast sea of pink and blue, right? Hope you enjoyed it. And if you have any comments, do put in the comment section. I'll be more than happy to clarify that, right? See you soon in the next video. Till then, bye bye.